In this podcast episode, Mel Robbins engages in a profound conversation with Dr. Szal, a distinguished physician and expert in autoimmune diseases. The discussion centers around the alarming statistic that 80% of autoimmune diseases affect women, delving into the underlying causes, symptoms, and potential solutions for those grappling with these conditions. Dr. Sarah begins by explaining the fundamental nature of autoimmune diseases, which occur when the immune system mistakenly attacks the body's own tissues. This confusion can be likened to a case of mistaken identity, where the immune system, designed to protect against invaders like viruses, fails to distinguish between harmful and healthy cells. The result is the production of autoantibodies, which target normal tissues, leading to various health issues. The conversation highlights the distinction between autoimmune diseases and autoimmune disorders, emphasizing that the former represents a more established condition, while the latter can include a range of symptoms and antibody presence without a formal diagnosis. Dr. Sarah notes that there are over 100 recognized autoimmune diseases, including rheumatoid arthritis, Hashimoto's thyroiditis, and multiple sclerosis, with many individuals remaining undiagnosed for years. A significant portion of the discussion focuses on why autoimmune diseases disproportionately affect women. Dr. Sarah points out that biological factors, such as genetic predisposition and hormonal changes, play a role, but cultural and social factors are equally significant. Women often prioritize the emotional needs of others over their own, leading to chronic stress and neglect of personal health. This societal conditioning results in a higher incidence of autoimmune diseases among women, as they frequently experience trauma, stress, and caregiving burdens. Dr. Sarah emphasizes that the rise in autoimmune diseases correlates with increased levels of stress, anxiety, and depression among women. She notes that many women are conditioned to be nice and to suppress their anger, which can further exacerbate health issues. The conversation underscores the importance of recognizing these societal pressures and their impact on women's health. Dr. Sarah identifies three primary root causes of autoimmune diseases: genetic predisposition, leaky gut syndrome, and environmental triggers. Genetic predisposition refers to inherited factors that may increase susceptibility to autoimmune conditions. Leaky gut syndrome occurs when the intestinal barrier becomes compromised, allowing harmful substances to enter the bloodstream and trigger immune responses. Environmental triggers can include trauma, hormonal changes, and lifestyle factors. The discussion highlights the importance of understanding these root causes to address autoimmune diseases effectively. Dr. Sarah explains that while genetics cannot be changed, individuals can take proactive steps to heal leaky gut and manage triggers, ultimately empowering themselves to improve their health. The symptoms of autoimmune diseases are often nonspecific, making diagnosis challenging. Common symptoms include fatigue, joint pain, and inflammation, but they can vary widely depending on the specific disease. Dr. Sarah encourages listeners to seek medical attention if they experience multiple symptoms, as early diagnosis can lead to more effective treatment. She also discusses the significance of testing for autoantibodies and inflammatory markers, which can provide valuable insights into an individual's immune health. Dr. Sarah emphasizes that understanding one's health status is crucial for taking informed steps toward healing. One of the most empowering aspects of the conversation is Dr. Sarah's emphasis on lifestyle medicine as a means to address autoimmune diseases. She advocates for an elimination diet, which involves removing gluten, dairy, sugar, and alcohol from one's diet for a period of 3 weeks. This approach helps identify food sensitivities and promotes gut healing. Dr. Sarah also highlights the importance of stress management and emotional well-being. She discusses the concept of the PINE network, which connects psychology, immune function, neurological health, and endocrine balance. By addressing trauma and stress, individuals can create a more regulated and healthier internal environment. Breathwork is presented as a simple yet powerful tool for regulating the nervous system and promoting a sense of safety within the body. Dr. Sarah guides listeners through a brief breathing exercise, illustrating how even a few deep breaths can shift one's physiological state. The conversation delves into the impact of trauma on health, particularly in women. Dr. Sarah explains that adverse childhood experiences can have long-lasting effects on physical and mental health. She encourages listeners to assess their own experiences and recognize how unresolved trauma may contribute to current health challenges. Dr. Sarah emphasizes that healing from trauma is possible and that individuals can reclaim their health by creating safety in their bodies and addressing the root causes of their symptoms. She underscores the importance of seeking support and utilizing therapeutic modalities to process and resolve trauma.